Hello, this is a video to go over the I-131 consent for cancer. And so I'm going to start off with when you go to the waiting room, you use your ADIT principles. And we have our patient, and her name is Frida Kahlo. So I will go and ask for her. This is Frida. I will go and ask for her. She'll will come in to the room, and if she has a family member, we'll let her come in and listen as well. So I'll get started. So I'll walk over, make sure you have all your paperwork, and you'll walk over to the waiting room and make sure they're checked in and everything. And so here I go to the waiting room. And you want to make sure you have all the forms with you so you're not scurrying for forms while you're talking to the patient, because that kind of makes them a little bit nervous. Anyway, so we're going to go in and use your ADIT. So I'm going to go ahead and call for Frida. Frida Kahlo, are you here?
Yes, hello.
Hi,
That's
Frida.
me.
My name is Allison. I'm a nuclear medicine technologist. I'm going to be talking to you about precautions for your radioactive iodine therapy.
Oh, thank you. I'm so nervous. I'm so nervous.
I know.
I hate it.
Yeah, we'll answer all your questions. Don't worry about it. Most people are nervous at this point. So
Can I take my coffee back with me?
go ahead. You can now. Yes.
Oh, good. Thank you.
You're welcome. Just take it easy on the caffeine. All right. So what is your first and last name?
It's Frida Kahlo.
Okay. What's your date of birth?
Oh, it's 7/14/1974.
Okay. And then you have an armband on?
Oh, yes, I do. Right
Okay.
there.
Excellent. Good job. This should probably take us maybe about 25-30 minutes. I'm going to go ahead and just talk about everything, and then if you want to interrupt me, you can. If you want to wait till the end, you can do that as well. So
Great. That sounds great. And your name again? I'm sorry.
My name is Allison Clevin.
Thank you, Allison.
You're welcome. So we're going to go over that, and I just want to thank you for choosing our hospital to come get your treatment. What's the name of your doctor that's sending you here?
It's Dr. Hesselhoff.
Okay, sounds good. And when do you see Dr. Hesselhoff again?
Oh, I have to do blood work. I have to do that after I have my scan, and then I see him a couple days after the scan, he told me, because he told me I couldn't go in right away.
Right,
I don't know why, but I guess you're going to tell me why.
Exactly. Sure will.
Okay.
All right. First that we need to do, Frida, is make sure that there's any chance you could be pregnant or breastfeeding. And they should have sent an order, and you should have had some blood work done before you.
Yes. Dr. Hesselhofer is very thorough. He had me go do blood work, and I did that a few days ago, and he said the results would be sent right to you. Okay. And I got that on our medical records software. I printed here that it is negative. You have proof here. Okay. Oh, good.
Yes. And I'll tell you why. It's a good thing. So what we're going to do here is I'm going to hand you some paperwork to let you know when it'd be safe to go be in public again. But we're going to see you next week to scan you, and plan to be here about an hour. When you come back.
You'll tell me when and everything.
Yes. And that paperwork that I share with you and give to you when you get your pill will have all that information.
Oh, good.
Yeah,
I'm very forgetful of that, but I'll remember it.
No problem. And you can always call the department and ask for me, or any one of the techs that work here can answer your questions.
Oh, great. Thank you.
Okay. And if we can't, we'll have you call your doctor's office.
Okay.
Alrighty. So here is a piece of paper and a pen. So if you think of any questions and don't want to interrupt me and just write them down, you can do that.
That's great. Yes, I
All
think
right.
I forget things. I'll write things down.
Right, and then because some of the questions the doctor has to answer.
Oh,
and
okay.
Here in California, I will consent you, but then the radiologist comes in and consents you, and then you're cleared to order your capsule. So,
wow, this is a big deal, isn't it?
Yes, it sure is. We just want to make sure everything, dot our I's and cross our T's.
Mm.
So, are you on a special diet? Did they put you on a diet?
Oh, yes.
Okay. Did they give you a time frame for that?
Yes, they told me I have, when I get the pill, I have 2 more days for the diet.
Okay, good.
I've been on it for 2 weeks already. Yes.
Yeah, okay, I know. The reason we want your body and your thyroid cells to be starving of iodine, because the iodine that we give you, we want that to be absorbed very effectively. So we don't want those cells blocked by the iodine that you have in your diet.
Oh, yes.
We want those cells starving for the iodine, so it's
That's
effective.
Why no milk in this coffee, just black.
Good, excellent. You listened to your diet restrictions. Yeah. Good job. And did they give you a time to any medication? Are you on any medication?
No. I've been feeling better. I'm off my antidepressants now.
Okay, that's fine, and that's okay too. That only thyroid medicine. They told me,
I think it was because of my thyroid and stuff. So I
right.
better. Mm-hmm.
Okay. All right. And so when you come back, we won't give you a pill again. We're just going to be imaging you the capsule that you take tomorrow or today. Gotcha. You won't be getting an extra pill. We'll just scan good. What you have inside. Okay.
Gotcha.
And when you come tomorrow, I want you to bring some lemon drops or sour candy. And what that is used for is probably 12 hours after we give you the pill, we want you to start sucking on the hard candy. And what that does, it makes you salivate, and it protects your salivary glands. Because a lot of times patients that get this treatment lose their taste buds, and we don't want that to happen.
Oh, no.
So with the sour candies, you're able to express and get rid of the extra radiation out of there, so we can save your taste buds.
Well, that sounds good. I I love lemon heads. I'm going to get some lemon
heads. Oh, that's perfect. Yeah, get those.
Okay.
And then, again, the diet questions, they said, when you can go after, diet questions can be addressed by your doctor, by your endocrinologist.
Okay.
All right, let's have some questions about your living situation. Very important.
Okay.
And let's see. We already checked for your pregnancy status. Frida, is there any chance that you have any incontinence issues?
No, I'm pretty good with that.
Some women in our age group do, after childbirth or at our age.
I think I'm pretty good, only if somebody tells me a really good joke sometimes.
Right. Yeah. We just want to make sure, because the radiation leaves your body within the first 24 to 48 hours. That's when your urine's going to be very radioactive.
Oh, okay, boy.
And do you live near the hospital, or how far do you live?
Just like about 6 miles away, not far.
Okay, so you won't be in there 2 minutes. Are you coming alone, or are you someone coming with you?
Oh no, they told me I need to drive by myself.
Okay, good. Good.
I'm just going to come by myself. My daughter was worried and wanted to come, but I told her no.
Good, especially if she's within childbearing years.
Oh, yes, yeah.
You don't want to sit next to her.
Yeah. I have a little dog, but he's not going to come either.
Oh, you have a dog?
Yes.
Does that dog sleep?
Look, want to look?
Sure. Is it?
I brought it with me today. He's my, what is that kind of companion?
Therapy animal?
I can see, but he's like one of my what is it? He makes
therapy animal?
Yes.
Therapy. Good.
Yes, therapy, yes.
All right. Does he sleep near your head at night?
Oh, yes. He cuddles with me. He's
for the first 2 to 3 nights, you probably shouldn't.
Really?
because the
Oh,
radiation.
this is me. He likes to lick my face.
Yeah, you probably don't want that to happen for the first two,
Oh
3 days.
no.
I'm sorry.
Oh, look, he's already upset. He
I
heard.
know. I'm sorry. But
Oh,
they,
well, yeah,
our
here comes
pets.
my daughter. My daughter, maybe she can, he likes her too.
Oh,
Here
that's
she is.
good. Good. Because
She'll have to
pets,
take him. She'll take him for this time being.
good.
How
Pets
long
and
is that
small,
going to be though?
pets and small children need to probably stay away from you for about 2 to 3 days
Oh,
when you're getting rid of the big dose load.
and I might need my antidepressants again. I might have to talk to Dr. Hesselhofer. Okay, but
You do
I'll
that?
figure
All
it
right.
out. I'll
And
keep
then,
it away.
so do you ever get car sick when you're driving? Probably only when you're a passenger, huh?
Yeah, no, I have a very strong stomach.
Okay. And how about, are you able to swallow capsules and vitamins? And you're okay with that? Okay.
Yes, it can be big ones if you want to. I can
All
get
right.
them.
They're usually just a medium-sized capsule, and so you'll be okay. Sometimes it's 2 capsules.
Okay.
Most of the time, it's just 1.
Is it going to make me feel warm and hot?
No side effects to it. It's very rare. The only side effects I have had my patients have in the last 10 years is probably a little soreness, and that's the candies will help the dryness of the throat.
Okay.
You have a
So
little bit of a sore throat. But other than that, we're available. I'll give you our phone number. If anything happens when you get home, you give us a call.
Oh,
Even if it's after hours, I want you to page nuclear medicine when you call the hospital, and we'll give you that phone number, okay?
Oh, that's great.
So don't worry.
Anything weird. Okay.
All right. And so, Frida, do you live alone? Do you live in apartments? You share?
Well, I have my daughter and my dog currently.
Okay. So you sleep alone currently?
Yes.
Except with the dog?
I do have, I have sometimes if I meet someone,
Okay,
but I guess I won't be going out.
I was gonna say, just do, you're gonna have to sleep alone probably at least for the next 2 weeks, okay?
All right.
Just animals and other people and children have thyroid, so you are gonna be, it's kind of like, I like to use the flashlight analogy. You turn on that flashlight, and anybody you point the flashlight you're next to, they're gonna get a radiation dose. And then the next day, you have that same flashlight and it's still on from the day before. So it's going to start wearing down, right? It's not going to be as bright.
Oh, yes.
Every day it wears off and gets,
okay.
So that's kind of what the radiation dose is going to do every day, is going to wean down.
Okay.
So
just, yes. So by myself. Yes.
By yourself is the safest. Yes.
Okay, great.
Okay. And then what do you do for a living?
Well, I'm an artist.
Okay, so you mostly work alone then? You don't work with children? You're not a teacher?
No.
Okay. Let's see.
I'm not really around children unless I'm having an art fair somewhere, and I don't think there's any coming up.
Right. No, you probably don't want to, you're going to have to be a hermit for the next week. Unfortunately, I'm sorry about that.
No, that's fine.
Okay. So we have your transportation. You're going to drive yourself.
Yes.
So once we give you the pill, we want you to walk straight to your car and leave. Okay. You can't go shopping. Do your shopping before you come get your pill.
Okay.
You're going to have to go straight home. I guess you could go through a drive-through if you really needed to pick up food on the way home, but don't get out of your car. Yes. And don't be in a place where you can't control people walking up to you.
Yes. No,
okay?
I'm just going to go straight home. Yes.
Good.
I'll have everything ready. Mm-hmm.
Right. We've had some patients that come on public transportation or they take a taxi, and you won't be able to do that.
Okay. No.
And then also, you're not from out of town. Some folks will want to stay in a hotel or a motel, and that's strictly prohibited. Because you cannot control, we don't want the staff that's cleaning the room to deal with the radiation exposure. The radiation is excreted in all your body fluids, and especially your urine. So, but if you're gonna we're going to want those sheets to be washed after about 3 or 4 days, and we want those washed separately, but I'll go over the laundry instructions in a little bit here.
Okay. Oh, that sounds wonderful.
Okay.
It
And
all
if
makes
you have
sense so far, so that's great.
good, yes,
Taking
you're good
notes.
to go so far.
Yes.
If you have to stop and use a bathroom on the way home, don't use a bathroom that's for the public. Try and, if you can, try and stop like at a gas station that has a one toilet option, like on the outside.
Okay.
If you can, if you have to.
I think hopefully I'm planning just to go straight home.
Okay.
After, so that's my plan.
Alrighty. So what we can do now, if you have any questions about radiation, I don't know what your if you have questions, you said you're an artist. I don't know how much.
Yes, if I'm the only one, I do have. So I know so I have my own bathroom.
Good.
And I will tell my daughter tonight. I have my own private bathroom.
Okay.
And I also have a little art studio, but only I go in that art studio.
That would be the perfect bathroom to use.
Yeah. Am I able to go into my art studio, or do I just need to stay in my room for 3 days?
Nope, you can go into your art studio. Just make sure you're the only one in there. You can also go outside to your backyard if you want to do some gardening.
Oh.
That's fine. If you want to take a walk in your neighborhood by yourself,
yes,
not with a neighbor, and make sure you don't stop and talk to your neighbors, you can do that as well.
Oh, well, that's much nicer. So, I thought it was going to be just in my room. And then I'm going to, of course, like throw out everything that I touch into the trash. I'll have all my
And you know, I talk about certain times of the year. Some patients in the summer sweat a whole month, a lot more than they do in the winter. If you physically see sweat rolling off the top, you know, you're having a hot flash or something like we get at our age, and you see moisture coming down, you're going to have a little bit of radiation. So just be careful if you're going to read something that it can be put in a place at least a week or 2 after you're done using it.
Oh, I don't need to throw it away then.
You don't have to throw it away, but you can't use like somebody else's phone, or you know, you want to keep that to yourself.
Got you.
And I'll discuss how to clean that up also here as well.
Great. Oh, good.
All right. So, you know, there's radiation that's everywhere. We have background radiation. Here in California, you're at sea level, so you're not getting as much to say as someone in Albuquerque, New Mexico. Or Denver, they live at a mile high, they get a lot more radiation. So the average person in America gets about 300 millirem, and these are just numbers that we have here. You know, radiation workers like myself, we can only, you know, we can get up to 5,000 millirem a year. So that's the range. You know, when you fly in an airplane, you get radiation. When you have a CT scan, you have radiation. When you smoke cigarettes, you have radiation. So it's everywhere. And what we're doing, we're using I like to tell people that radiation exposure is like a bank. You can afford to get so much, but you want to control how much you have and save it for times like this when you do need a lot of radiation for therapy. Okay.
Oh, okay.
All righty. And good. And then so you want to do your best at exposing family members and the public. And here in California, that's a law. So you're going to be signing paperwork, knowing that you have radiation in your body and that you're going to do your best to try to not expose people.
Oh yes, I'm going to go right home.
Okay, so I know that's not the case everywhere in the United States, but here in California it is.
Oh.
Let's see. So I-131. So your body sees the iodine as you ingest it. So it's not going to know the difference. It's just going to think it's a salty burrito or whatever in the capsule. your thyroid cells will pick it up just like dietary iodine.
Oh.
The half-life of the iodine we're going to use is 8 days. So that's why, along with your body getting rid of it, plus the half-life of it decaying, we consider it, about a week, 72 hours to a week to get it totally out of your system.
Oh, okay.
Sort of that flashlight to get dimmer and dimmer and dimmer.
Oh, yes. Mm-hmm.
The radioactivity, you're going to be emitting gamma radiation. Do you work on near a base or an airport, or are you planning to travel anytime soon?
No, I don't have anything really scheduled. Okay, but if I did, yes, if I was going to fly somewhere, is that a problem? Even if it's 3 weeks from now?
Well, probably 3 weeks is probably good, but we still want to, you'll still have some in you. And what we'll do is we'll write out a card that you can travel with for your wallet. And if you do, if they do pick up some of that radiation, you'll have proof that you had it for therapy reasons. Okay.
Oh, great. Yes.
The iodine we use is water soluble, so that's good if there's any kind of contamination from your body fluids. You can clean it up with water, but you want to use gloves. But the best thing I like to tell folks is to use the Lysol wipes.
Oh, okay.
Because it's also, disinfecting the area as well, and you can throw that wipe away. Okay. And I will also talk, so that leads me to the trash, and we'll talk about that trash coming up in a little bit.
Oh, okay.
Okay. This iodine treatment has been around for 60 years. It's helped a lot of people. So it's nothing new. We've done a lot of these. Mm-hmm. Previously, when we give a dose, like this, you had to be in the hospital. But now, through this consent process, you can go home. If we have patients that aren't allowed, that don't, they live in an apartment, or they don't have a home that they can isolate themselves, then we allow you to stay in the hospital. We'll allow you to stay. Okay. So we talked about body fluids, we talked about your urine, we talked about the flashlight analogy. So time, distance, and shielding, which shielding you don't have to worry about, that's for us. Time is if you do come up, someone walks up to you after you get your capsule on your way to the car, just pretend you have a cold or something that you can't talk to them. Just keep walking. You're going to have to, unfortunately, be rude. Yes. The quicker time next to somebody, the less radiation they get. Okay. And then if you do have to speak to someone, like a neighbor talks to you on the other side of the wall, your neighbor, if there's at least 10 feet in between you, that's okay. Because you have that distance.
Outside.
If you're outside doing any of your work, right.
Okay.
So you want to keep your distance.
And what kind of time frame is that where I have to kind of watch my distance with people? Is it just the 3 days and then I'm good?
3 days is the most important.
Okay.
That's when the quote unquote flashlight is the brightest.
Okay.
So after about the 3 days, and then your age and you're able to hydrate properly, you're going to get rid of the unwanted radiation very quickly.
Oh, good.
In the first 24 hours to 48 hours, most of it will come out of your system. So that's why you need to be the most careful with your body fluids.
Okay.
So again, we talked about not sleeping with anyone. Don't sit next to anyone on the couch. If you want to watch a movie with your daughter, make sure she's on another chair.
And that, and when I can do that, it's okay for me. After the 3 days, I can go back out into my house and out of my room.
Right. You can. Probably the first 2-3 days, maybe try and stay in your room.
Yes.
But after that, again, keep that 10 feet away from your daughter. Okay. I know kids like to come and be on your moms, but
yes.
And their moms and parents. So
yeah, and she understands. She'll stay away.
Good. Mm-hmm. And then let's talk about, so you're going to keep your distance at all times if you can help it. And do not perform strenuous workouts, again, because of the body fluids that you're increasing the sweat.
Oh.
So you're not going to want to get on a
Sweat.
treadmill the first couple days and just be
Oh.
dripping, because all of that sweat that drips is going to
I'll have
contaminate
to
your
stay away
treadmill.
a little further away from it. Maybe I won't do any kiln work then. That puts off some heat in my art.
Yeah, if you sweat a lot, probably not. And if you do,
I'll wait on that.
If you're by yourself, you're okay. So you can't go to a gym.
No.
You're gonna have to work out at home.
Okay.
You can take, like we talk about, you're able to take a walk around the neighborhood if you walk alone. We talked about pregnant females are very sensitive to radiation. So if you see someone that's physically pregnant, or absolutely do not stand next to them for the first 2-3 days.
Got it.
Children as well, they're very sensitive to radiation as well.
Oh, okay.
All right. Blankets, couches, chairs will not be contaminated unless there's fluid present. So if you notice that you are sweating, you're in a really hot room, and or you're incontinent a little bit.
Yes.
Yeah, just be careful with that.
Okay.
You're going to sleep alone.
Yes.
And you're going to avoid sexual contact and kissing for 1 week. Anyone else.
Okay.
Your bed linens, after you're done with your bed linens, probably after about a week, we want you to get a laundry bag or a plastic bag and put all of your linen in that and your clothes. Okay. And we want you to wash that separately from everyone else's clothes.
Oh, okay.
Don't wash it with your daughter's clothes. Don't wash it with your pet's blanket.
Okay. Okay, good to know. So I don't have to throw those things away.
Don't have to throw them away. You can wash them, and then the washer's fine after that because it rinses it out.
Just wash them, all my stuff separately.
Separately, yeah.
Gotcha. Okay.
Let's do, so we talked about the different ways that you can contaminate, like your treadmill. You said you're not going to be on your kiln and getting warm.
Yeah, it's hot. I think I'll stay away from that.
We're going to talk about the hygiene. That's very important as well. We don't want you to take a bath for that same reason, because you take a warm bath and you start sweating. Only take showers in this week.
Oh, okay.
After that, you can probably, you can take a bath, and that's fine.
Okay.
You use plenty of water while showering, and then rinse the shower down when you're done showering, especially if somebody else is using that bathroom.
Okay. Well, and fortunately, I have my own private one, so.
Good.
But I'll still
and then,
rinse.
So, after 2-3 days, rinse it down. So when you do use it next week, you won't expose yourself to what was left in the shower. Okay.
Mm-hmm.
And I know this is kind of an awkward thing to talk about, but we do remind patients, do not urinate in the shower. Some people do, some people don't.
Gotcha.
So that urine is very radioactive, so you don't want to do that.
Got it.
All right, so you have plenty of water. Do not spit in the shower, and do not blow your nose in the shower. Those are 2 other ways that you can leave radiation in your shower.
Gotcha. Okay.
When you're brushing your teeth, we want you to rinse your mouth close. You want to put your mouth close to the sink, because if you stand up and you spit into your sink, there's an increased chance that you could be splattering your saliva, which is radioactive. Okay. So when you brush your teeth, and also get a toothbrush that you can maybe possibly throw away. Because you use that toothbrush for about 3 days, and then toss it out.
Okay.
All right, and then maybe have a paper towel and put the toothbrush on that paper towel so it doesn't drain onto the counter and contaminate your bathroom sink.
Good idea. Yes.
Okay.
Yes, good idea.
And then toss that toothbrush when you're done. Especially the first 2-3 days, when you use the restroom, we want you to flush 2 or 3 times.
Okay.
Okay. We just want to make sure you sit down. I know you're female, so my male patients, I have to remind them not to stand up.
Oh, okay. And just flush it twice after I urinate.
Yes, please.
Okay.
And then at the end, we want you to clean your bathroom with the Lysol wipes, but use gloves so you don't absorb it into your hand.
Okay.
All right, now let's go talk about the kitchen. We don't want you preparing anyone else's food. because it's just too tempting to go in. You know, I cook like this and I stir and I taste and then I put the spoon back in the food. Don't want to do that because that's your saliva that could be radioactive, and you're putting that back in the food.
Okay.
Use disposable utensils is probably the best.
Okay. And then I can
try to
throw it
keep
into the trash.
And it's going to go into the trash. So now what we're going to do, you're going to have a little pile for your linen that you use for that week. And then you're also going to have your own trash. Okay. I want you to have one bag that you put all of your utensils in, all of your tissues in. Okay. Anything that has a body fluid that you use in the next week, we want that in one trash by itself. Okay. And the reason we're going to have you do that is because we are going to have you secure that trash bag in a secure location like a shed or a garage for 1 week. Okay. So say you get dosed today, save all your stuff for a week, then you can store that bag for the next week's trash if you live in the city limits. Reason being is that your Kleenex can be radioactive, and a lot of the landfills here in California have radiation detectors. And they can, if they track your trash to your house, you can get cited. And we can also get cited as well. So hold on to that trash if you can and secure it. Make sure no animals can get in there and rip the bag open and spread that Kleenex all over the place.
And it's okay. Also, I mean, if I have to blow my nose, I could flush that too.
You can also flush it, no problem.
Okay, flushing's okay. All right.
All right, so, and you don't want to share any of your silverware or your plates. If you don't have disposable, you can go ahead and just rinse it. Just don't share your cutlery or your plates with anyone in your mugs. Okay. And you'll also, it's probably a good idea if you don't have that disposable, let those dishes after you're done using them after the week, let those sit somewhere also for another week. And those will decay down to where after that week of storage, it'll be fine.
Oh, okay. Okay. Sounds good. Mm-hmm.
All right. So you're going to bag all of your trash and hold it for 1 week. And I already told you about the landfills. Discard after week. Clean all of your sinks that you use at the end of that week. And we talked about laundry here, holding on to your, keeping it all together and washing separately. If you wear dentures, we want you to make sure you clean those as well. Lots of rinsing of the dentures because it's gonna be with your radioactive saliva. If you use a BiPAP or any kind of breathing for sleep apnea, make sure you change your mask out because that's gonna be touching your mouth as well, which will be radioactive, your saliva. Contacts, if you use contacts, those can be radioactive as well. So you'll probably want to toss those out after a week.
Okay.
We talked about cleaning your bathroom, what to use. Make sure you clean your toilet, sink, and your shower. Lysol wipes is the best, or any kind of spray cleaner that's going to be able to wash and disinfect down the drain. Clothing, sheets, towels, we talked about that. Yeah, any of your towels after you get out of the shower, you can wash that with your clothes and your linen separately, not with anyone else's, okay? Talked about the trash. Cell phones and computers and remotes. Only if you physically see any of your sweat on these devices. But it's not a bad idea to use the Lysol at the end of the week as well.
Oh, okay.
To wash some of that sweat off of those devices. Okay. And you can hang on to them. You don't need to get rid of them either. Okay. If you want to use plastic bags over your devices, you can do that too. Be a good hand washer. Now that with the COVID, we're all learning to be very good hand washers, but for radiation purposes, it's good as well. Okay. Use gloves if you can, but be wary of using the gloves all the time because then your hands will start to sweat in the gloves, and that sweat will be radioactive rolling down your arm, and then you'll touch something. Got it. Just gloves, just not all the time, only when you need them. So right before we give you the capsule, we're going to have you go to the bathroom so you don't have to use the bathroom on the way out.
Oh, yes, good.
Okay. So what it will do is I'll ask you now if you have any questions, but I'm going to go ahead and call the radiologist, and it'll probably take him or her about 30 minutes to get here. So in that 30 minutes, if you think of a question, you write it on that piece of paper that I gave you.
Okay.
Again, we talked about that you're able to swallow vitamins and capsules. Is that right?
Yes, I can.
Okay. When you leave, when you go, if you have to go down to the parking lot for the elevator, if you're healthy enough, if you can use the stairs, it's probably better. But if you can't use the elevator, just make sure it's not a full elevator when you're going down. And if you see it full, just wait for the next elevator. Okay. You just don't know who's going to get in that elevator with you.
Oh, yes, like a baby or something. Yes.
Right. All right, so I think that's it. I covered everything. Have you thought of anything, Frida?
Now, like my room. I'll be staying the 3 days in my room, and I can go into my art room. Say my daughter like has a job that she leaves the house. Am I able to, if no one's in the house, can I go out to the kitchen and get something to eat that on my own?
Yes, you can, but just don't cook for them. And like we discussed.
Okay. So I can make my own things and then bring them back and everything.
Absolutely.
And if I sit, because I'm all by myself in the house, I can sit at the kitchen table, or do I need to just go right back to my room? If you know.
I think you can. Maybe the first day or two, maybe go back to in case you're warm and you're sweating and you don't want to leave your body fluids anywhere.
Okay, that makes sense.
We talked about that possible slight incontinence that you might have, and you don't want to be sitting on your upholstery. So.
Oh, okay.
Okay.
No, that makes sense. Yes.
Any more questions?
No, I think
I gave you. I'm giving you the phone number. If you think of any questions when you leave, that's fine too. Okay. You can call anytime. You can call any of us anytime.
Oh, good.
All right. So if you say tonight, it's very rare, but if you do happen to get nauseous and throw up or anything, you can page us immediately. We'll tell you what to do. Okay.
Okay. Well, my doctor, he gave me a prescription just in case. Okay. And he said, because sometimes I get nervous. He said I have an anti-nausea pill, and I'm thinking maybe when I get home, maybe I'll just take it. But I have a pretty strong stomach anyway. But yeah, and And
I have paperwork that has everything that I just talked about in case you don't remember. Wonderful. I'll give you that, and then we'll give you time frames of when you can go out into public.
Oh, great.
And you'll be here an hour when you come back, or when you come next week. You're going to be in a scanner, and that scanner is going to, be over your head for a little bit. So if you're claustrophobic and you need to take medication, make sure you bring it with you.
Oh, okay. Do you have to wear any kind of special clothing for that scan?
Try not to wear metal.
Oh, okay.
Try not to wear a bunch of metal zippers, especially going down the middle part of your body.
Oh, okay.
Okay, and then we're going to have you drink a cup of water before we put you under the scanner, because a lot of the times the salivary uptake, we want to clear that from your throat. This is real important. Your neck area is a really important place for us to be looking at next week.
Oh, okay. Can I eat breakfast before I come in?
You can have a light breakfast. Yes.
Oh, okay. Oh, good.
So, okay. Thank you much. Do you have any more questions?
Oh, no, and I have the phone numbers and everything if I come up with any. Yes.
Good. All right, Frida, good luck with everything. This is very successful.
So much. I think this will be fantastic. Yes.
Good. All right. Talk to you later. We'll see you tomorrow when we give you the pill.
Oh, awesome. All right. Bye-bye.
Okay. Bye-bye.